A lot of families looking for answers. Raquel, thank you so much. We are going to join the Prime Minister as he brings his address. Let's listen in there.
Lab techs and hospital staff are hard at work to keep us safe. They're showing up for us, and we need to do the same for them. Over the weekend, we received new shipments of essential personal protective equipment, including 4 planes worth of N95 masks. As we speak, workers are unpacking and validating these supplies so we can start shipping them to the provinces and territories as quickly as possible. These new N95 masks are in addition to the more than 820,000 that went to provinces last week. All told, this means that we have 1.1 million N95s ready to be shipped to the provinces and territories, with more to come. We have also received millions of pairs of gloves and will be getting new protective gowns delivered from domestic suppliers starting next Monday. En fin de semaine, on a reçu 4 envois d'équipements de protection.
Over the weekend, 4 planes worth of personal protective equipment arrived, including N95 masks. There was also an order for Quebec. These new N95 masks are added to the over 820,000 masks received last week. We are preparing to send 1.1 million N95 masks to the provinces and territories over the next few days. We've also received millions of pairs of gloves, and we will receive new protective gowns as of next Monday. As for the tests, we are now making huge progress. I'm thinking of Spotted Bioscience based in Ottawa that will provide tens of thousands of test kits per month. As Dr. Tam was saying yesterday, over 430,000 tests have been done in Canada. We will continue to increase our testing capacity and to find new technology to simplify testing throughout the country.
In the last few days, we've also made progress on testing. Right now, we're moving forward on a range of rapid testing kits, both from here in Canada and internationally. This includes Ottawa-based Spartan Bioscience, who will soon be supplying tens of thousands of kits per month and potentially more as production increases. As Dr. Tam said yesterday, more than 430,000 Canadians have now been tested for COVID-19. Our experts and health professionals are working hard to increase our capacity to keep ramping up tests across the country. Demand for these supplies is going up, and we're going to make sure Canada can keep up.
COVID-19 has changed people's daily lives, but those who are living in the Arctic regions don't have the same issues as those who are living in cities. For example, I know that many are concerned to see empty grocery store shelves, and others don't know if their healthcare center has enough space and enough resources to fight against the virus if it sets into their community. We are doing everything we can to avoid this. Today, I'm announcing that the government will invest close to $130 million to assist northern communities in their fight against COVID-19. From this sum, $72.6 million will be sent to the Yukon, to the Northwest Territories, and Nunavut for their healthcare system needs and to fight against COVID-19. We are also allocating funds to Nutrition North Canada so that food and essential goods remain affordable and to help families to stay healthy, and so that food and medical equipment can be brought there. We are working with air carriers who will bring essential products to the north. Finally, I know that many businesses in the north have been hard hit by this crisis. We are going to provide help to business owners whose expenses are not already covered by the other measures that have been implemented.
We're investing almost $130 million to support northern communities in dealing with COVID-19. If you live in the north, chances are you're worried about whether your local health centre has the resources to fight COVID-19 and to cope with cases that might come up. So we're providing $72.6 million to the Yukon, the Northwest Territories, and Nunavut, specifically for healthcare and community preparedness. We're also investing more money to Nutrition North Canada. This will make it easier to afford the food and basics that keep you and your family healthy. And to ensure that things like groceries and medical equipment can continue to get to you, we're providing funding for Northern air carriers to transport these supplies. These are tough times, but we're going to help you through them, to set your community up to come back strong when things get better. Because they will. We have to think about small businesses, too. I know entrepreneurs in the North have been hit especially hard by this crisis. If you own a business and your costs aren't already covered by other measures we've put in place, we're giving CanNor more funding to help. No matter where you live, in a small community or a big city, we're here for you. This weekend, we brought Parliament back to pass the largest economic policy since the Second World War. With the Canadian Emergency Wage Subsidy, we will protect jobs by helping businesses keep their employees on the payroll. We'll be rolling this measure out as quickly as possible. And now, as many people as we've already helped, and we're talking about millions of Canadians, we know there is more to do. You might not currently qualify for the Canada Emergency Response Benefit, but you still might need a hand. If you're a student or an essential worker, for example, this week we'll be talking about how to reach you, while also supporting sectors that have been especially hard hit. At the same time, we're working to enhance the Canada Emergency Business Account, as well as new supports on commercial rent for businesses that are hardest hit. I'll have more to say about all this soon. If you've come back to Canada from abroad, as of today, we are strengthening measures. Now, if asymptomatic travelers cannot explain a credible quarantine plan, they will be required to quarantine in a hotel. This will come into effect at midnight tonight. We are also announcing $20 million for the Canadian Food Inspection Agency to strengthen food inspections and keep our food supply safe. This will mean we can build capacity for more overtime and extra shifts for inspectors to fill demand. It also means we can invest in things like hiring and training to get more people on board. On vit des moments difficiles. Et à travers le pays, je sais que
We're going through a hard time, and I know that many people are concerned not only for their future and their health, but for that of their grandparents. The elderly are especially vulnerable faced with COVID-19. That means that we should not go visit them in long-term care homes, in healthcare institutions. To protect them, we have published new guidelines for this type of establishment. We have set out clear rules on restricting visits, on measures of control for staff, and what to do in case of infection. At the same time, we continue to work with the provinces and territories to ensure that they have everything they require to make sure that people stay healthy.
I want to take a moment to speak directly to everyone who's lost a loved one. If you're grieving, know that you're not alone. We are here for you, even through this incredibly tough time. And you remind us why it's so important to do everything we can to keep one another safe. We all need to do our part. We can't let up now. So to everyone, stay at home. And no matter what, stay 2 meters apart if you do have to go out. When it gets hard, let's remember that we're all in this together. Merci beaucoup. Et maintenant, prendre les questions.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par le téléphone. Modérateur, c'est à vous.
Thank you. Merci. The first question, Kate Bongaro, Bloomberg. Line open.
Hello, Mr. Prime Minister. I'm wondering, what is your government's concrete plan to reopen the economy? For example, a rolling, staggered, or an all-at-once approach? And can you give us more information about these plans and your discussions with the provinces on reopening the economy?
I know that everyone is very interested to know when things are going to get back to normal, when they'll be able to go back to work, when we'll be able to leave this isolation at home, when kids will be able to go back to schools. The reality is it is going to be weeks still. We recognize that it is going to be important to get our economy going and that we will have to do it in phases. We will have to remain vigilant until such a point as a vaccine against COVID-19 is found. We are having ongoing discussions with the provinces at this point. We recognize that different regions of the country are at different places along the evolution of their COVID-19 curve. We're going to make sure that we try to stay coordinated as best as possible, but those discussions are ongoing about how we're going to reopen the economy. It's just that it's going to be a while still.
And you had just mentioned sectors.
Sorry, let me answer in French. Évidemment, les gens veulent savoir.
People want to know when we will be able to go back to normal life, when they can go back to work, when children will go back to school. The reality is that we have to be extremely vigilant. We have to continue for several weeks still. But at some point, I hope we will be able to begin easing up on some measures. We'll do that in coordination with the provinces. We recognize that different regions of the country are going through impacts that are different. They are not at the same place on the COVID-19 infection curve, and we will be vigilant up until the time that we have a vaccine. These conversations are ongoing, but it's not for right now.
Just mentioned about sectors who have been especially hard hit by COVID-19 and that we should be expecting news on help for them soon. And I'm wondering specifically, when is the oil industry bailout coming?
First of all, we recognize that the most important thing from the very beginning was to get help out to Canadians right across the country, regardless of the sectors they're in, regardless of their situation or their location. That's why we put forward two extremely strong measures that help all workers across the country: the Canada Emergency Response Benefit for people who've lost a paycheck, and the emergency wage subsidy so that people can keep their jobs and be ready to come back to work when the economy comes back. As I've said a number of times, we will and we are looking at more specific sector-related relief and supports for those sectors that are hardest hit, whether it's the tourism sector, the airline sector, or the oil and gas industry or others, and we will have more to say on that shortly.
Thank you. Next question.
Thank you. Merci. La prochaine question, Raymond Fillon, TVA, à vous.
Bonjour, Monsieur le Premier ministre.
Hello, Mr. Prime Minister. Now, with regards to the seniors' homes, I know that this is provincial jurisdiction. Other than guidelines, what can your government do before a situation as what we see in many seniors' homes in the long-term care home Heron in the Montreal region, for example? These stories are horrifying, and we send all our condolences to families that are affected by the high death rate in our long-term care homes for seniors. And this is why we would like to highlight the extent to which people need to follow instructions. People need to stay home and continue with social distancing to stop the spread of COVID-19. As you're saying, the long-term care homes are a provincial jurisdiction. We have set out guidelines, and we will continue to work with the provinces to do everything that we can to assist them so that our seniors stay safe. We recognize that they are the most vulnerable to COVID-19, and this is why we all, at all levels of government and all Canadians, we have to do everything in our power to protect them.
Recognize the terrible and tragic stories that have come out of seniors' residences and long-term care facilities across this country. And our hearts go out to families who've lost loved ones in some terrible ways. We know we need to do more, and that is why we are highlighting how important it is, not just for ourselves, but for our loved ones, for our healthcare workers, for our seniors, that we continue to follow directions, that we stay home as much as possible, that we keep 2 meters apart wherever we can, and that we continue to wash our hands regularly. We need to make sure that our seniors who are most vulnerable to this are protected. As mentioned, seniors' residences are provincially mandated, but the federal government has put forward guidelines for across the country on making sure that our seniors are protected.
Suivi, oui.
Un des gros problèmes dans ces centres, c'est le manque criant d'employés.
One of the worst problems is the lack of staff. Could we put the armed forces? Could we use them to help out? There are measures that are being taken by the provinces, for example, to force people to work only in one long-term care home and not several. This will help to protect the elderly. But this will also create the need to hire people, the need to find extra workers for these centers in order to help out the seniors. We are working with the provinces. We are trying to make sure that we have the capacity and the ability to have the necessary staff to help the seniors.
Some of the measures taken in place to protect our seniors in our long-term care facilities, such as asking people to only work in one centre instead of a few of them, will mean a need to hire more people to support our seniors and to work in those centres. And we're going to continue to work with provinces on ways to ensure that people can be found to do this important work.
Thank you. Prochaine question, modérateur.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. I would like to come back to your stay at Harrington Lake. For several weeks now, the authorities have been telling us not to go to our cottage, and in Outaouais there are checkpoints on the bridges so that people don't cross from Ottawa into Gatineau. So I'm wondering why, in the case of your own family, it was okay for you to go there. I announced this last week. I said that after 3 weeks of working here, my family, who is living at Harrington Lake, that I would go spend Easter with my family, and we continue to respect all the guidelines.
Mentioned last week in my presentation, after 3 weeks of my family living up at Harrington and me working here, I went to join them for Easter. We continue to follow all the instructions from public health authorities.
Merci. Question de suivi, Hélène.
Mais oui, avez-vous eu une indication comme quoi
Yes, but did people tell you that this was okay? All over social media, people are wondering why this exception was okay for you. Why it was okay for you to go see your family at the cottage. My family has been living there for 3 weeks. This is where my wife and my children live. And as I announced last week, I was going to go spend Easter with them there.
Merci. Next question, Alex Ballingal, Toronto Star. Line is open.
Morning, Prime Minister. You mentioned in your introduction that people traveling to Canada will need a credible quarantine plan. Can you expand on what the government's definition of a credible plan will be? Who will assess that, and where will that be applied at the land border as well as at airports?
The order that goes in tonight is a strengthening of the Quarantine Act orders to give authorities the ability, upon evaluation of the person entering Canada's plan to self-quarantine. If it is inadequate, they will be required to quarantine in a hotel. Examples of things that could be inadequate, for example, if their plan is to go stay in a place where there are many elderly family members at risk of COVID-19, or whether they don't have a set destination if they've been outside of the country for many years. We now have the authority to require them to self-isolate for 2 weeks in a quarantine location like a hotel.